Hi, my name's J.O. I'm the author of Maximize Your Medicare. The 2020 edition is new, published by Allworth Press. It's available on Amazon.com. You can also order it from your local bookstore. They'll be able to get it for you. Today, we're going to be comparing plans F and G, which are Medigap plans. Now, recent legislation has changed the eligibility for Medigap Plan F. Nevertheless, it's still worth a look. So professionally, I spend a great deal of time on Medicare. As you can see, I've written this book. It's in its 8th edition. It's just part of a suite of financial planning products, financial planning process that I help individuals and companies with throughout time. Those needs change as circumstance and the market changes. Lastly, I spent a lot of time in financial markets around the world as a bond derivative trader. And it gives you an insight on how I'm comparing things that look the same but aren't exactly the same. And today's video, exactly that. So let's start with the basics about Medigap. And this is a grid taken from the book. It is the federal grid, so there's not going to be a difference between this grid and the grid you see as sent to you by different insurance carriers. So you can see that the main thing to take away about Medigap is that all the plans are standardized. And what that means is that, as you can see on the left-hand side, the text on the left-hand side of your screen, that, for example, standardized means that Plan N from Carrier 1 is exactly the same as Plan N from Carrier 2. They're the same down to the comma. They must be the same. Okay. Outstanding issues about Medigap, the number one is that there is no network, meaning that if the healthcare provider, doctor, hospital, durable medical equipment provider, blood lab, if they accept the federal Medicare card, the red, white, and blue card, they will accept Medigap, period. Period. Now, what can move? The rates, the premium. Your premium can change based on age. That is certainly the case. What it cannot do is it will not change. It cannot change based on your individual claims. It will be based on the group of the policyholders' claims and the insurance company's projections of what the cost will be in the future. Now, the most frequently asked question that I get is, oh, well, if they're all the same, can I just simply shop by price? Well, in theory, the answer to that is yes, right? Since Plan N is the same from Carrier 1 to Carrier 2, you would think that they should be similar in price and that you should just choose the cheapest price. But in practice, as a practitioner, my clients around the country, it's far more subtle than this. Number one, transparency is pretty poor. If you try to click around and get the best price, that probably isn't the best price. That's the candid reality, even if you can get the price. Okay. The second reason is that there are many subtleties involved. What are some of these subtleties? Certain carriers give a household discount. For example, if your spouse enrolls in the same carrier, some carriers don't require you to be at the same carrier, literally. So even the definition of what household discount is differs from carrier to carrier. And these aren't small differences. These are 5, 10, 15% differences as far as household discount goes. In addition to that, because the market is so competitive, right? In other words, in particular counties, I've seen this where the costs are not high, centering around the low 100s for Plan G. I can find certain counties 5, 6, 10 carriers within $10 a month. Now, does that necessarily mean that I just choose the lowest price? No, and that is the recommendation that I provide to my clients. The answer to that is no, because it's more subtle than that. And there can be reasons that I might suggest one carrier over another, even when the price is this close. And actually, it's part of the reason, meaning that if they're that close on price, why would I take a particular carrier? There may be a specific reason that I try to avoid or try to get something extra from certain carriers. For example, in these days, many Medicare, Medigap providers, insurance carriers, have started to align with health clubs. So what you have is you have Medigap, but then additionally attached to it at no extra cost can be the Silver Sneakers membership. That is now occurring, evolving in the Medigap market. We're going to get more of those going forward. We definitely, almost certain, the writing's on the wall. That competitive. And that's one of the things about Maximize Your Medicare, is that there's a set of things you can control. There are rules that apply to you. You need to know them. You need to know them well. But then there's an extra set, which is the set of sellers. And you may be suspicious. There's skepticism in our country. I get all of that. That said, they are competing and are competing fiercely. I think fiercely is probably an understatement. Back to the topic. So now we have Medigap, and you can see Plans F and Plan G here, right there in the middle. And they do look very similar. But there is a nuance, which is under Plan F, the Part B deductible is paid. In 2020, that number is $198 a year. Now in 2021, that's going to be a different number. We do not know what it is as of this video. Medicare and Plan F combined with each other, right? They pay for all Medicare approved healthcare services in full, period. Your bill then should always be zero. So I always tell my clients that if they have Plan F, look, if you get a balance due, you need to wait until your Medigap provider, the Medicare system, and your healthcare provider have all communicated with each other. These three parties have to communicate and reconcile. From that point, your bill should read zero. Now, Plan G is also in that way, except that the Part B deductible is not paid. You're responsible for the first $198. And once the Part B deductible is satisfied, then, just like in Plan F, Medicare plus the Medigap policy, they take over. Literally all Medicare approved healthcare services are paid in full. Now, you can see here that in addition, by say in full, that also means that if the healthcare provider charges the excess charge under Part B, which they are legally allowed to do in almost every state, except I think it's now 8, where they have a specific rule that prevents this. In those areas, no matter what, Plan F, Plan G pay for your Medicare approved healthcare services in full. That doesn't mean they're exactly the same. And here's the point of the video today, right? Which is that under Plan F, the Part B deductible is paid by the carrier, which it charges it to you in the form of higher premium. And if you take $198 and you divide it through by 12, so you get your kind of like your average monthly cost, that is $16.50 a month. Okay? Under Plan G, since you're responsible for the $198, the Part B deductible, you would expect the difference between Plan F and Plan G, the premium, to be $16.50. Because since that is the only difference, and we know its value is $16.50, you would think that that is the premium difference. However, that's not the case in real life. There is a premium difference even at the same carrier. Even at the same carrier. So carrier number 1 charges $110 for Plan G. That same carrier will be charging more than $126.50 for Plan F. Almost, I've never seen it lower than this $1,650. Let's take a look at these differences, and you can see what ends up happening. So let's just take two different carriers. Let's call it carrier X there on the left, carrier Y on the right. And this kind of pricing difference does exist in the real world. This does exist in the real world. So you can see carrier X charges $110 for Plan G and $146.50 for Plan F. Now we can know, as I said from the last slide, $1,650 is due to the Part B deductible, which means there's an additional amount, right, of $20 a month on top of the Part B deductible. Do you see it? 110 plus 1650 is 126.50. But the actual sticker differences are 146.5 to 126.5, which is $20. Let's go to carrier Y. Different pricing. This will happen in the real world. Okay? So what you can see here is that Plan G is $105 a month. So what are your takeaways? Competitive, $60 a year difference. Plan F under the same carrier is charging $156.50 a month. And so now you can go to the math again, right? For example, and do I have the math wrong? No, I don't. So once you add these differences, what you end up having is you can see that carrier Y is charging $35 a month, right? $105 for Plan G, carrier Y, plus $1,650, right, is $121.50. But carrier Y is charging $156.50, which is $35 a month more. So they're charging much more for their Plan F as opposed to Plan G. And these are real numbers, where you can find numbers, even though I created the examples, these are market-related numbers in many, many areas of the country that exists. So let's move on here. The question is, are these differences worth it? So, and the answer is maybe. The answer actually is maybe. Some people would say, no, this is never, ever worth the extra money. Never say never is what my first response being. And here are some people. $20 a month, right, may be worth it to some people. Why? They dislike medical bills. They dislike medical bills. Who are you? Other people. You go to multiple doctors. And the cost of keeping track of all the bills is expensive. We're going to get to an example of a snafu that can happen, which I have seen, which is very complicated. And the reason is that under Plan G, you've got to keep track of the Part B deductible, which can be delayed or wrong. Okay. Now, somebody says, well, okay, this never happens. No, this happens all the time. When is it? We're going to get to the example in a few slides. Who else? Well, there's some persons, other persons just too busy to manage, right? So the first set of persons are, look, I've got a complicated medical situation, but that's not the only person. Other persons like too busy. I have clients that are working full-time, small employer, they're the owner. They've got so many plates spinning. The idea of looking at the bill and reconciling the Part B deductible isn't worth it, not worth it to them. They're willing to pay what I call this extra difference then is a convenience tax. Not my job to tell you, whether or not this tax is worth it. You don't see anything here that says Jay thinks that this is worth it. That will not come out for me because why? I'm not there valuing your money and your time for you. That's your prerogative. Of course it is. But I don't want to say that the administrative hassle is, imaginary. It's not imaginary. Let's take a look at this example here. Person with some situation goes to the doctor on January 1. And we're going to have to hit pause here. Now, some people have come to me and said, Jay, this kind of thing just doesn't sound realistic. Well, here's an example of something that can and does happen. So you go to the doctor on January 2nd, checkup, the cost of appointment, $200. And that would then make you have satisfied the Part B deductible. You pay at the counter, they say, okay, you haven't met your Part B deductible. You go there, you pay the $200, and then you've satisfied the Part B deductible. Well, you go to the doctor, that same doctor, and then you realize you need to get to a referral to another doctor, or they order lab tests. So now you go to another doctor appointment number 2 on January 8th. And the cost of appointment at a specialist is $300. Let's just call it $300. You go to the billing department, says they're looking for your insurance. And what ends up happening is the billing department says, well, you've not met your Part B deductible, therefore your bill is $300. Well, you have already paid $200 on January 2nd. To you've already satisfied the Part B deductible. Nevertheless, on January 8th, Medicare doesn't have record of this yet. Their records aren't updated. The doctor didn't send the bills correctly, processed invoices in a timely fashion to the Medicare system. Therefore, according to Medicare, you've not met the Part B deductible. Now, this gets even more complicated, right? Because in addition to that, since Medicare doesn't understand that you've met the Part B deductible, that is also the same thing that Medigap carriers rely on. So, according to them, you've not met the Part B deductible, meaning the insurance carrier, the Medigap carrier of Plan G, they know that they're not responsible because that's what the information provided to them tells them. Sometimes what ends up happening is people call me and say, Jay, the carrier doesn't want to pay its claims. No. That's almost impossible. Okay. The idea that the carrier is systematically avoiding paying claims. Okay. It feels bad on an individual level. Think 60 million possible customers. And if they break the rules systematically, they have to answer to the federal government. They're closed. Okay. That doesn't make practical sense. People in the world full of common sense throw it away when it comes to financial stuff. But here's what can happen, and this does happen, and more problems can ensue because if doctor number 2, right, that's on your right hand of your screen, isn't the doctor, but let's say it says, okay, now it's some serious stuff where the bill is $3,000. Then what ends up happening is because of the fact that Medicare doesn't know, and then you go to doctor 2 whose bill is now $3,000 or whatever services are required there, can be $3,000. Also, the Medigap carrier isn't liable. In other words, they're not responsible for 100% of everything else there because you've not met the Part B deductible. What ends up happening? Doctor number 2 sends out a notice to a collection agency. So I'm not saying this is going to happen. I certainly don't hope this happens, but the idea that administrative hassles don't occur under Medicare are not correct. So you can see this is certainly the case. Oops, not exactly. Is plan worth it? Nevertheless, there are some people who want to pay for Plan G, right? Which is that depending on your market, depending on where you live, you can't identify this number. You can't identify how much the convenience tax is. It can be $50 a month. That's a lot of money, no question. I am not here to tell you what to do with $600. I'm pretty sure $600 is a lot of money. I'm pretty sure $600 is a lot of money, right? Who are you almost definitely that aren't interested in paying for Plan F? You don't go to any doctors. You think that Plan F is going to face more rapid premium increases than Plan G. We're going to address that next. But just know that what's not on this list is the idea that you think that the Part B deductible will increase. Because guess what? Both plans are going to change at the same rate. Why? Because both of them have figured out they're the data taker, right? The Part B deductible, if it's 198 in 2020, and it's 208 in 2021, the difference will be reflective of that. Some people say that, okay, Jay, why are you discussing this? Plan F is no longer available. And let's just briefly review the rules. That yes, in order for you to apply for Plan F at this point, you must be both enrolled in Part A and in Part B, both, prior to January 1st, 2020. If Part A and Part B are both active, you have coverage dates there, like John Smith in the card. Today, he can enroll or apply for enrollment in Plan F. But he will be subject to underwriting. Let me say here that there are certain states with far wider enrollment rules in the Medigap. Far wider. State of New York, the obvious, right? Which always has open enrollment to every Medigap plan available in the state, period. So the question is, can you switch? And there's your answer. Can you switch from G to F after thinking to yourself, I don't want to deal with this administrative matter, and the differential between the two is narrow enough, it's worth paying the convenience tax? Yes. You can switch. You must pass underwriting. And here it's important that unless you're the state of New York, unless you have open enrollment to enrolling in any Medigap plans, at other states, they don't have this exception. Meaning you can change from Plan G to Plan F, but those states which have like the birthday rule that exists and for example, in Oregon or in Washington, they've got modified, or they've got an anniversary rule, birthday rule, depending on your state. California has the birthday rule. Yeah, but you need to be going to the equivalent plan or weaker, not a plan with additional benefits. That means that from G to F, formally speaking, requires underwriting. Now, can the carrier waive this? The answer is yes. Can there be exceptions? The answer can be yes, but the regulations are not the ones to protect you in that instance. Last year, a lot was made of this because we knew that Plan F was going away, meaning that Plan F for the general population, for persons turning 65 or persons who were thinking about retiring and then enrolling in Part B, some were thinking, okay, maybe I'm going to use this opportunity because it's closing to get into Plan F. On the other hand, other parties tried to tell me, okay, well, I'm going to keep away from Plan F. Plan F shouldn't be recommended. You can see other YouTube videos that say this. And you can also see my YouTube video, which I've made in the past. I've said I don't spend time in second guessing this. I don't. Because it's true. Let's just go through the facts here on this slide. It's true. Plan F won't have newly turning 65 people into it. Okay. The flip side of that coin always exists. That may be better, right? Because that also means that the sick persons aren't let in, right? Because since Medigap open enrollment rules allow anyone in, irrespective of your medical situation, even if you had Social Security, even if you had Medicare eligibility prior to 65 as results of incurable disease, doesn't matter. Doesn't matter. Medigap open enrollment rules mean if at turning 65 and turning on your Part B, then you get unrestricted access. That also means that guaranteed issue, the side doors here, right? That what happens is people use guaranteed issue and they can no longer do that to get into Plan F. They can only do it to get into Plan G. They can only get into Plan G using guaranteed issue. Guess who goes into guaranteed issue? My clients go there. Why? Because I know they're ill, and the only way to get into Medigap, because they will fail Medigap open enrollment because the time has passed, may be through a side door called guaranteed issue. So what have I just done intentionally on my client's behalf? Those are the rules, right? The client gets the coverage they want. However, the entire pool is slightly less well off. Guess who already knows this? The carriers. Of course they know this. Absolutely, 100%. The idea that I'm sitting here singularly telling you this scenario in isolation as the only person out of more than 300 million people in this country, forget it. Right? I tell persons, the person setting the price on these policies, unlimited computing power, unlimited legal resources to know the rules precisely. If they're setting these prices, Plan F versus Plan G, whether that be $15, whether it be $35, $50, they're doing so intentionally. They have a commercial reason to do so. What are those commercial reasons? Number one, maybe they want to win market share in that location. Number two, maybe they're trying to get away from market share in a particular reason. Absolutely. They have their own set of business strategy to price not only where Plan G is, but also where the difference between Plan F and Plan G is. They have different underwriting rules for persons who are not part of guaranteed issue, who are not part of Medigap open enrollment. These differences in questions they ask are notable. They're not random. Let's not presume that they're random. Let's presume that those are the smart guys in the room. And they are. It's a compliment to them. Now that I've, let me swerve back here to now that I've, swerved off the path. What does this also mean? That also, by its same relation, that same relationship also means I could easily say that Plan F is going to be healthier. Healthier. Why? You're 67. You're the owner of a small business. You got into Part A and Part B 2 years ago. You qualify for Plan F. However, right, you still have to medically qualify. Guess who does this? Who gets in? Only the healthy. Only the healthy. And so now What happens? This 67-year-old who now has retired says, okay, I'm done with owning my business, decides, I don't want to deal with the bills. I've got vacation to go on. That person, if getting accepted, who are his fellow policyholders? Also persons who passed medical underwriting. What does that mean? Healthier. What does that mean for future increases? Lower. Lower. So I've spent a lot of time on this slide because literally I think that persons tried to take the easy way out and just simply said, okay, the intuitively attractive message is, okay, Plan G is going to be crowded full of people my age, and therefore it's going to be better because they're just going to let in the younger. That's also not necessarily the case, because you know what happens every 2 to 3 years? The carriers switch pools. If you're 69, don't presume that you're getting a new 65-year-old in there. I wouldn't presume that at all. Why? Because they reset the pool. The bottom line here is it is putting you in this situation where you're thinking that you're trying to outguess the insurance carriers. For me, that is not a good idea. Plan F, certainly, you have to be healthy in order to gain entry. That you do know. That you do know. And if I had to choose, if I could control age or quality of health of the pool, I would absolutely choose the higher, the better healthy pool. No question. How do I know this? And this is a personal story. Is that, what I don't really talk about very much is the fact that I grew up in a medical household. My mother, my father, late father, was physician. My mother is a widow. My father predeceased her. Well, she is on a Medigap plan. She's well over 65 by over a decade. And the fact is, her premium for Medigap Plan F is lower today than it is for a 65-year-old. Why? Why? Simple reason. Her fellow policy owners are American Medical Association policy owners. How would we call them? Is their DNA superior, meaning that they're less susceptible to get sick? No, clearly no. What is common amongst doctors' families? No heroic care. No heroic care. Almost across the board. And I'm telling you something that you already know. Right? Which is doctors, the idea of a doctor having some major surgery at 83 years old into a physician's immediate family, that's like a no-go, right? They turn it down. What do? As a result, they incur lower claims. As a result, my mother's premium is literally equivalent to that of a Plan F for a new 65-year-old today. That's all I've got today. There are going to be more videos in rapid fashion. Next up, we're going to be comparing Plan N versus Plan G and F. Okay. There are lots of ways to link up with me. Podcast, videos, there's a newsletter. There are all sorts of links on this website. So there it is there on your address, maximizeyourmedicare.com. Your address, my email address is there at the bottom of your screen. You can send me your questions. I'm going to answer the first one for free for sure. The way it works is that if you're going to just ask me for my assistance in helping you select a plan as a broker, I'm going to charge you $0. Okay. The only time there'd be a professional service cost is if I've got to weed through a bunch of tax matters, if I've got to give you advice about your other financial planning interactions with Medicare or health insurance. And don't get me wrong, there are many, many. You can go to my other videos. You can see it. You can see Life's a Gamble. It's the one that I released just a few days ago. And the point of the fact is that Medicare looks, and too frequently what is happening is people like to keep separate things separate. That sounds true when it talks about church and state. But when it comes to financial things, what happens is these interactions are getting more complicated. Taxes, especially, right? Because reality is health insurance now is a tax matter. People think of health insurance as, oh, I went to my doctor. No, health insurance is a financial product, and that means taxes. And so now you need to know about other interactions, which is a shortcoming of the way that you're being given information about Medicare, Roth IRA, Social Security claiming, portfolio management. Hopefully you liked today's video. Be sure to subscribe to the channel. I'll be back in short order. Be sure to pick up your copy of Maximize Your Medicare, Amazon.com, your local bookstore. They'll all carry it. If you have questions, you can send me an email, jae@maximizeyourmedicare.com.